Let us know your experience with telehealth and how do you see it moving forward?
Well, thank you for this meeting because I think sharing best experience with my colleagues using Drapp application will add to me. I want to mention two things. I was first in the beginning against any telemedicine applications in my life, but when I saw Drapp and I saw the application itself, I found that it is full of taking history of the patients, medication I need to give, or any even investigations. So I found that the application is very close to what we're actually doing in the clinic. So I don't forget my patients because, you know, sometimes we need the documentation and the application provides us with documentation for each patient and registration, which is very helpful for me when a patient calls me back in a month or 2 months. I can recall through the application what is exactly the problem, what medication was prescribed, the labs. Even in the chat part, I can share with the patient some reviews to read, some papers to read, which is very helpful compared to other applications that I have been introduced to before. Another point I'm using Drapp for is that sometimes even in my physical visiting patients in my clinic, they are living in another government. They need about 6 hours to reach Cairo, or probably they live somewhere, or their work schedule doesn't allow them to visit the clinic. They can follow up through Drapp, which is convenient for the two of us. The third thing is through Drapp, I was able to consult patients outside Cairo. Okay.
So connecting with
yes, not just in Egypt, but also internationally, Middle East and in Canada. The flexibility of sending me a text message and then I can schedule the meeting, and the patient gets the recatch notice so that they can be online on time is extremely important with using the telemedicine, because the patient could get busy for an appointment tomorrow and forget. I could get busy and forget. So the recatch is extremely a useful part of the software. Having the audio and have the video is very important because I get to see the patient. It's not just a phone call. I get to hear and communicate with the patient. It's not just a text message. This is very crucial in the field I work in, which is psychiatry. It opens other domains. I can see that a lot of my patients are using Drapp nowadays, and they find it very convenient for them to either consult, to follow up with me, or even to contact me for need to make sure that they understood the regimen of medicine intake. So it's not just for cases that are contact.
What is the feature that you use the most in Drapp?
The one I use most is the recatch, so that I get reminders of the appointment with the patient, and when is scheduled, the follow-up, if I'm giving a medication, if I'm requesting a lab, everything. And if I didn't prescribe a patient a medication, I get an instant message from Drapp reminding me that I can prescribe the medication, and I can even request some investigations where the patient will have a discount in certain labs.
Excellent. Okay, thank you, Hadi.
Quick question, Dr. Mona, thank you. How do you see telehealth in general helping removing the taboo of psychiatry specifically? Yani we know in our part of the world, yes, they don't want to go to psychiatry clinic, part of a taboo. How do you see it helping the patients?
It helps a lot because some of the patients, as you mentioned, they don't like to go to the clinic. Plus, sometimes patients who are having a severe condition, they need an immediate help. So they can send the request and ask about what's the problem. If it's an emergency, I can get to the patient immediately. He doesn't have to, or she doesn't have to book an appointment or wait for another 2 to 3 days. Flexibility of choosing the appointment that's suitable for me and for the client is a major feature. We get to agree about what time are we both available, irrespective of where we're living. Telemedicine has proven to be of great value during Corona, as Dr. Fadi mentioned, where all of a sudden the whole world if stopped, and patients were needing to reach their doctors, their physicians. They need to re-prescribe their medications. They were feeling lonely. They were feeling anxious, panic attacks. They need to reach their doctor immediately, just at least to make them feel that it's okay. You can take the medication. You can go for the ER. So it helped a lot in reaching the patient, and the physician reaches the patient immediately in case of needs. has يعني كمان في نقطة تانية عايزة أقولها استنى. And it also helped us as physicians to expand the range of our service to outside our area of working, which is in Cairo, for instance. The third thing is that we have a lot of our people living abroad, and none of them are frequent in psychiatry. They like to talk about their symptoms in their own native language. So if they're living in the States or living in Canada or in France, they might want to talk to an Arabic-speaking physician. Drapp has provided them with an Arabic-speaking physicians for them abroad, outside the Middle East. So for instance, when a family in Canada contacts me through Drapp, I think it's because they want an Arabic-speaking or someone who has the same cultural upbringing to discuss and to understand, rather than to have a foreigner physician.